Medical Training, Take 3. Step-by-step demonstration brought to you by myself, CSM Chilli, and clone recruit Lucid. I'm gonna put him to sleep first. A couple of different wounds. Strike his face and his chest. Alright, step 1 when arriving near your patient is you have to assess them. So to do that, you're going to want to check your heart rate first. He has a heart rate of 99. That is good. Next thing, I'm going to check his airway. All of that took, what, all of 3 seconds? Airways are clear, medical suction is needed. But before I do anything with his chest, I need to stop the bleeding. They can last longer without air than they can without blood. So we're going to stop any bleeding, fix the airways, and get fluids back into him. Kind of ragdolled on me, don't sweat that too much. May have done too much to his chest. I prefer packing bandages just because they stop the bleeding a bit quicker than a quick clot will. But their reopening chance is significantly higher than that of a quick clot bandage. So once I get his head fixed, bleeding stop there, I'm going to monitor his vitals and see what we have to work with and what we got to fix next. Takes a couple of seconds for that. Obviously, if he had any problems in his limbs, I would just immediately tourniquet them. Alright, so our patient has a heart rate of 96, his blood pressure is 87/58, and it looks like it's holding, and his SpO2 is good. But remember from when we checked the medical suction, what you got? We needed to
training over here when I'd be ready.
Double check on his copy, just finishing up the medical recording now. Double check on his airways to see what we needed. His airways are clear, but we need medical suction to suction the patient. You go with an AccuVac. You're gonna hear a little gross suction noise. Who cares? Be a man. And after that, I'm just gonna place a King LT airway because he's unconscious. And we want to make sure that airway is secured. That's why we give the King LT as opposed to the Guadal tube, because that is going to maintain his airway open and all of that. So he's lost a lot of blood. Next step is we're going to establish an IV. So the difference in the IVs, the higher the number, the smaller bore of the needle. The smaller the bore, the slower fluids go in. So I like to give a 16 gauge needle if I'm only giving, or if I have to give a lot of fluids, or there's a lot to be done with an unconscious patient. So I gave the 16, he's lost a lot of blood, so I'm going to give 1,000 milliliters of plasma. It's pretty standard for any T-CCC type move. That's going to be your immediate thing to go with. We're going to see if the lung sounds are set up. So I'm not hearing anything, so it probably means that the server settings are not compatible with oscillation of lung sounds yet. That's okay. Nobody else is going to be able to hear them. So his pressure dropped a little bit. No, it stayed the same about. He's getting those fluids in, nice and steady. So my next step for him is he's going to be in pain when he wakes up. So what you can do is give him anything, but I'm just going to reorient him and get everything set. Anatomically speaking, you see how he's on his back, his head's up-ish, his arms are split out just like that. It's going to look just like that. That's called the anatomical position. So his blood pressure is starting to come up. He's now 89/59. Very slowly, and he's already down to lost some blood. Because of everything that he had, I'm going to give him an additional 250. And while I'm there, I'm also going to inject a morphine on him because I'm assuring that he's been hurting. So that could be part of the reason keeping him down. His heart rate's starting to come down to a more stable number. You see that 80. And he's awake. Look at that.
That was a nice nap.
That was a nice step. I'm sure it was. Don't move. I'm gonna remove monitoring. And the patient has been fixed. So because I'm Zeus, I'm gonna give him a quick pack, so he'll be good as new. We haven't configured all of the medications that we're gonna use. Just remember the training as to what all of them are for. Epi, if he's in cardiac arrest or has a low heart rate. Adenosine to drop his heart rate. Morphine as a pain management, but be aware of morphine because it is also going to drop his heart rate and blood pressure.